And good afternoon, everyone. TJ Alds, I-45 now, Galveston now, joining you here today for our weekly segment with Dr. Philip Keiser. He is the local health authority for Galveston County, as well as the interim CEO for the Galveston County Health District, as well as Coastal Health and Wellness. And we are talking about COVID-19, the Delta variant, and the surging cases that we are seeing across the way right now. And Dr. Keiser, there is some trends you're seeing right now that are concerning to you.
Yeah, no, our numbers are really going up very rapidly. I think we're actually not even starting. We're probably about maybe a quarter way into our latest surge. We had a surge last year around this time. We had one around Christmas time, and now we're having one again.
In fact, let's take a look at these numbers right now, and this is a comparison of those surges you just talked about, the cases per week by surge. Just for folks that are looking on the screen here, to give you an idea of this is that what you see in blue, that's last summer. All right. And what you see in orange, that was January this year. That right after Christmas, and then the gray, the far left, that lower one, that is what we're going through now, starting at January 21st. And if you look at the bottom of the screen, you'll see the numbers 1, 2, 3, 4, and so on. That's weeks that we're talking about. One of the things we should point out, if you cannot make it out, folks, that number in the gray over here to the left, that's the current trend we're in right now. That's 670 cases per week. Now, that's actually week 4. You were telling me right before I went on the air, you've got the numbers confirmed for week 5, and that's gone up dramatically.
Yeah, to about 900. There's something called logarithmic growth, and that's basically where, it goes like in a straight line and then it starts taking off like a rocket or a jet plane standing on its tail. And that's where we are. And we're seeing that happen. And so as we move forward in the next several weeks, I think we can see numbers of cases as high or even higher than what we saw in the last 2 surges.
And in that, let's go back to that July 20th surge that's marked there. We see a high at, about week 8, 9, 1,664. Then it dropped off dramatically. What was what you would say made the difference in that surge that happened there?
Yeah. So what happened was at that point, Governor Abbott closed all the bars and closed restaurants down to 50% of capacity, or less than 50% of capacity, and had a mask mandate. And when that happened, we saw things drop dramatically. So that was the 4th of July weekend a year ago, and as just by masking primarily, as well as people staying distant, staying apart from each other, we were able to see those numbers go down.
And then we see that surge that was right after Christmas this year, and it got up to 1,800 cases, but then it dropped off considerably too. Mm-hmm. And I would take it then at week 16 or so of that surge, that was when vaccinations became readily available.
Yeah, that's right. So what we're looking at is mid to late January there. And so we started vaccinating in December, and we started doing the general public the actual weekend of January 1. And so about 3 weeks later, that's when you start seeing the numbers start dropping off dramatically. And if the way that played out was that we saw a huge drop, and then the governor lifted the masking requirements and the social distancing, and what we saw happening was still a continued drop, although not at the same rate. It was a much more slower drop until about 5 weeks ago, when we started seeing our numbers rise again. And what we've seen is driving this really is the Delta variant, and this thing is spreading much, much faster than anything we've seen before.
And one of the things, as a matter of fact, I found out a question one of our viewers has already asked. I said, and we'll take a look at it here. Barbara Bally asked, what happened to all of us getting better with vaccines. And that brings up another chart I wanted to go with that you sent over to me. Let me get that here real fast so everyone can take a look about. This is, we call it vaccinated versus unvaccinated. Talk about what this chart means here, and just so folks understand what we're looking at here.
Yeah, so we wanted people to see what happens if you're unvaccinated or if you haven't been infected with COVID. You know, there's been a lot of talk and even some studies suggesting that if you've been infected with COVID, it may protect you from getting reinfected again. And then, of course, we have people that are vaccinated. So, you know, if you look at it, we have three categories: non-vaccinated, people that are reinfected, i.e. they've been infected with COVID and then they got infected again, and then people that were vaccinated. So when we look at this, we have to consider what is our risk pool, or how many people are at risk. So our county has a population of 342,000, you know, and at some point before anybody got vaccinated or infected, they had a risk of 342,000 people. And of those, we've seen 35,000 infections, 1,200 hospitalizations, and 383 deaths. Now, interestingly, when we look at those people that have been infected, they become at risk for getting reinfected. So 35,000, we've had 230 of them get reinfected, 34 of them have been hospitalized, and only one of them has died. And then when we look at people that are vaccinated, as of last week, we had vaccinated about 170,000 people. We've had 229 infections, 12 hospitalizations among that group, and 3 deaths. And so when you look at that together, I think it becomes pretty clear that if you've been vaccinated, that's a good thing. You're not very likely to die. But if you've been infected and recovered, you're also not very likely to die. So I think that what this shows is that having been infected with COVID does provide you with some protection. But if you haven't been infected or you haven't been vaccinated, then that's where we're seeing the greatest risk of hospitalizations and deaths.
And in fact, that kind of goes to the question that Leela Robinson asking you to discuss the percentage of people hospitalized for COVID who are not vaccinated.
Yeah.
We should point out right now, these are the latest numbers that we have on that.
Right.
In fact, is that when we take a look at things, is that 65 people are in the hospital as of today.
Yeah.
Are the numbers in there. Yesterday, it was 49 total.
Right.
And we should point out, these are Galveston County residents in the hospital. UTMB Health system-wide, and that includes Brazoria County, the Harris County Hospital in Webster, as well as the 2 hospitals in Galveston County, is about 100 total right now. Not including, I don't think it includes the prisoners. That's still not part of the regular count.
Yeah, no, that's
that are in there, right? Right,
that's a different count. So it's 97 people. So that's getting up there now. You know, they had hundreds. I don't want to say several hundred, but over 150 at a peak point. And so it's getting disconcerting how many people are in the hospital, and it's getting disconcerting about how rapidly that's changing. You know, typically what we saw in the last 2 surges and all along was that people would get sick with COVID, they'd get diagnosed. The second week they'd start feeling bad. The second or third week they might get hospitalized. But this seems to be that people are getting hospitalized much sooner after becoming infected, which goes along with this being a much more infectious virus, and there's a lot more virus being spewed around in the air that people are breathing in. So that would mean that they would get infected faster and even get sicker faster.
In fact, let's take a look now at another chart you sent over. This is the risk of infection compared to what, and these are based on the numbers here. So that you have been able to put together as well. And so let's take a look at that as we see this and explain as what we're looking at on this chart here, if you would, Dr. Keiser.
Yeah, so basically what we're looking at are odds, or what we call a relative risk. So, just like when you have a horse race, the favorite, is like, 1-to-1 bet, but, in the really long shot has the highest numbers. Well, here it's just the opposite. So what we're doing is we're counting vaccinated as 1. That's considered, the gold standard. And we compare it to people who have gotten reinfected or people who have been non-vaccinated. So when you look at the risk of getting infected, if you haven't been vaccinated, your risk is about 85 or 86 times higher than vaccinated people, okay? If you've been infected, your risk is about 5 times higher. So what does that mean? That means that yes, getting infected does help protect you, but it's still not as good as having a vaccination. So, what I'd say is that if someone were to ask me, hey, I've had COVID in the past, should I get a vaccine? I'd say, yeah, sure. It'll help you out. You've got a higher risk. But if you've never been infected and you've never been vaccinated, I mean, you're playing with fire. It's 86 times more likely to get an infection. And then when we look at the risk of getting hospitalized, it holds up as well. 56 times more likely to get hospitalized than if you haven't been vaccinated. And if your risk of death is 70 times more likely than if you haven't been vaccinated. And again, we're seeing that there is some protective effect about having an infection in the past. And so those people that are saying, well, I've been infected and I don't need a vaccine, I'll say, well, kind of true, right? It does offer you some protection. How long is that going to last? We don't know. Is it as good as getting vaccinated? No. Would we recommend that you still get a vaccine? Yes. Am I really worried about people that had infections in the past, about them getting sick again? Not that much. I'm really worried about the people that haven't gotten infected.
Yeah, and that's a vast majority of these.
And that's the vast majority of people out there. It's about half the county right now.
Right. And it goes back and get Barbara Bally again. So after we answered a question before, this is what she posted. So those vaccines worked. Not. You say the chart is the exact opposite of that, correct?
I don't see how she gets a not there. I mean, we never promised anybody that they would never get infected. All right. So what do vaccines do? They do a couple things. They keep you from getting infected. They keep you from getting hospitalized, and they keep you from dying. So does that mean 100% guarantee that you're not going to die? No. Does that mean 100% guarantee that you're not going to get sick? No. Does 100% guarantee that you're not going to end up in the hospital? No. But, we've had 3 people who have been vaccinated that have died out of 180,000 people that have gotten vaccinated, compared to 383 people that have died out of, about a similar amount who have not been vaccinated yet. I would say that this shows pretty well that the vaccines work.
Yeah, let's go back and look at that chart, what you said here. These are those numbers you were just talking about of 170,000 people vaccinated, 229 were infected.
Right.
Of those who are not vaccinated, 35,000, and just the pure numbers there would play it out. And of those who got infections, the reinfections, that came along afterwards. And those 229 may include some of those who were infected, got the vaccine, and then still got reinfected as well. There's the percentages of that can go down. So, but the hospitalization, which is, by the way, I think and correct me if I'm wrong, is that not been a lot of folks focus on, well, it's a 1% death rate, but it's not been that so much of the focus as keeping people out of the hospital. Has that been more of the focus on keeping social distancing, vaccinations, and the like?
Well, think about, what a 1% death rate means. That means if 100 people, you've known somebody that's died from COVID. So the death rates are real. The other thing to keep in mind is that this is a disease of families, and that 1% is not 1% if it gets into your family. It actually takes more people than that. So that's very, very sobering. But more to the point, yes, our real goal is to make sure that the hospitals don't get overrun, and that we're able to continue to offer services to everybody, not just people with COVID. And where we've seen things really break down is when the hospitals get overrun. We saw that happen in New York. We saw it getting close to happening in New Orleans. So in the United States, this can happen. We've had people that, you look at India, you look at Italy, and you can see the real havoc that this can play if it gets out of hand.
Right. Let me ask on kind of, this is the most back and forth we've had with our viewers in a while here. You can tell we're getting a lot of folks with their different
Yeah.
Different thing here about that. What are we seeing as far as folks who maybe those few breakthrough cases that are happening? Are we seeing as severe of illness with those? For example, I go to the church camp situation we talked about, and granted, that's mostly teens, so younger people not as affected. But even those who had breakthrough infections seemed to they were asymptomatic for the most part, were they not? There was not anyone that had really any serious illness. No one went to the hospital
Well,
from that.
yeah, we've seen a little bit of everything. And I don't mean that to try and minimize things. I just want to be very perfectly honest with people. So for the most part, and again, these are generalizations, for the most part, people are asymptomatic or have mild disease if they have a breakthrough. But we have seen some people who have gotten pretty sick. When I say pretty sick, meaning that they feel bad, and they feel bad for a long period of time. The number of people who've been hospitalized with the breakthroughs is actually quite small. You can see we've only had about 12 of them, and the number of people who have been who have actually died has only been 3. Those were actually very elderly people, and so there was one question of, did they really die from COVID or did they die from something else? Their death certificate said COVID, so we decided it'd be best thing, just for transparency's sake and trying not to appear like we're covering things up, to count them. And so we're counting them in our group. But 99% of the people that are ending up in the hospital are not vaccinated. And with this current surge, the people that are dying, 90 to 99% of them are unvaccinated.
Here's something we hear a lot about the vaccinations, April White, but it's not fully FDA approved.
Oh, it drives me crazy.
Because
I mean, I agree with her.
Tell me when someone says that to you, what is your retort back?
So initially it was like, well, I have two things to say. The first thing is that that this is the most tested vaccine that we've ever had. And because we have modern ways of being able to track things, we can tell you when, 10 people have had blood clots that are very serious. We need to stop and look at that. That's never happened before. So we're able to track things in ways that we've never been. 1,000 people that have gotten the vaccine have gotten some inflammation of their heart, but none of them did it have any serious effects, and it went away for the most part for getting better. And so it didn't seem to cause a lot of harm. And that's an important thing. So I can honestly say that I think this is a very, very safe vaccine. But the fact that the FDA hasn't approved this yet is driving me crazy. And I'm sure it's driving a lot of people crazy. We know enough about this, and they have enough information that they could probably fully approve this today if they wanted to. And I don't understand what's taking them so long.
One of the things, though, too, I should point out is that for some folks, and I heard this from a patient the other day, who from another place in the country, it was a news report, who said, I'm just not going to get the vaccine. It's not fully approved, but right. He is being treated with treatments that they themselves are under emergency authorization. I wonder if you can talk about that a lot of these treatments, that those who are getting seriously ill with COVID, are they not, many of those outside of proning, which is a different setup, but as far as the treatments, medicines, a lot of times what they're getting, those them as well are emergency authorization, are they not?
Right. So the one thing we're using a lot of in the outpatient setting are the monoclonal antibodies, Regeneron, which prevent people from getting hospitalized. And actually, people who get these things say, I feel so much better. President Trump got it, and you can see how well it worked with him. A lot of people think that he wasn't that sick. Let me tell you, as a doctor, when I saw him giving his speech on TV about how he was going to the hospital, I went, wow, he's really sick. And so we have the ability to give people all of the same things that he got. And so Regeneron is not approved. It's emergency use authorization. The remdesivir, the antiviral drug, only has recently been approved by the FDA. The steroids that we use, they are approved by the FDA, but they're not approved for this particular usage. And so these are things that we do all the time as physicians. We will use things that are either not approved if we need to, and the FDA says we can use them on an emergency use. And certainly during the AIDS epidemic, we did that a lot. And we also use drugs that are not approved for the indication that the FDA has approved it. And so, we do a lot of things that don't have that official imprinter, but that we've learned, and we've learned the hard way, that they work and they work well. And so, the best thing I can say right now is that we've gotten a lot better at treating COVID, and it includes both treatments in terms of the drugs that we're using for either approved or unapproved uses, and it means that we've gotten a lot more clinical experience with things like proning, and it also means that we've learned some hard lessons, like don't be quick to put people on a ventilator. Wait as long as you can, because that causes more damage. So there are things that we've learned to do and things that we've learned not to do.
Yeah, and we've, as I said, we're getting a lot out here from folks. This is one of our more active ones. And it's
I know,
been a while since
they're going by so fast I can't read them.
And both of us can see these on our screen as we talk to you. But as I said, and we try to get all of you in. I know a lot of folks are asking about back to school. We're going to get to that, and that's coming up soon here. So we're not ignoring you here on that. I did want to bring up something Anna Culp said. She's talking about mask wearing. CDC maybe backtracking on some recommendations, even if vaccinated, about wearing recommendations about wearing masks inside. What do you think of that?
Yeah, no, we've actually been recommending that people wear masks for the past couple of weeks, and it's because we've been seeing how rapidly Delta has been passing through our community, and we've seen breakthroughs. And so, the big thing that we're trying to avoid is, particularly in people that are at risk for having a bad outcome, if you're elderly, if you have other types of complications, what would make it so that you had a bad outcome, you get either really sick or die from COVID, we're recommending that that people wear masks just to make sure. And I've started wearing a mask when I go out in public now again, and we're started doing that within the health department. Within all our clinical areas, we're making it mandatory. In our non-clinical areas where we don't have patients, we're strongly encouraging everyone to wear masks. UTMB is doing the same thing, and I think you're seeing this around, all around the country, that people are going back to wearing masks.
Yeah, and of course, and it's, we can only make recommendations. Not going to require anybody. We're not going to do that. But what do you are hearing as far as health or other organizations? Particularly, I know you can talk about the Galveston County Health District and as well as Coastal Health and Wellness. How about employees there? Are you going to, are y'all considering requiring everyone who works there to be vaccinated?
Well, we can't do that because, in the state of Texas, you can't require people to get vaccinated. And the governor has actually issued an executive order that prohibits government agencies of even inquiring about vaccination status in terms of access. So we're not doing that. Within the health district, we have a good ratio. Almost 90% of the people have been vaccinated. At UTMB, not as much. There's a lower rate. There are a lot of agencies and professional organizations that are arguing and requesting that, at least in the healthcare sector, that it be required to get a vaccination. So this is all in a state of flux. The president announced today that the VA was going to require people who are working as frontline healthcare workers to get vaccinated. To me, that seems like a reasonable thing, particularly if you're going to be around people that have COVID. It protects you and it protects other people. But we can't make people get vaccinated at this point.
But this flip side of that is obviously private institutions could do so. We saw with Methodist Hospital in particular, where there were a lot of nurses in their Baytown institution say, "Hey, we're walking out," and that brings up. And the reason I asked this, and I meant to click on it, Brenda Van Nice had asked this about, well, why aren't they? And that's the thing. If it's a state institution,
right? UTMB,
Health District, those are government institutions. As such, as Dr. Keiser just said, they can't even inquire about that. Anyway, so that's just so that And then so that's the difference. And I was just pointing that out to Rosalind Muir, that Methodist is a private institution. It's not a government institution. And that's the only places that the governor's order reaches to. It cannot tell a private business what to do. In fact, several court orders have already had, including that case with the Methodist nurses, came up and said, as such, you can't do that. So to answer the questions on that for you there. Let's go ahead and because we did have a lot of questions from folks. Back to school vaccinations here. There's a lot to kind of unpackage from that as well. The return to school is just a few weeks away for folks. We've got a couple of things happening on. Let's first talk about those under 12 years old, because right now the vaccines are approved. Pfizer and Moderna's are approved for those 12 and older. But under 12, the CDC this week said, all right, go add more children into those clinical trials. Where do you think we're going to stand just a couple of weeks from school for those who do want their children to be vaccinated?
Yeah, it doesn't look like for under 12 that it'll help us in Texas before schools open. They have been talking about having these studies done in time for school, but when they say that, they mean nationally, and most schools start after Labor Day, and we start earlier in Texas. So I was always expecting that we would face this scenario where we wouldn't be able to vaccinate the kids that were under 12. They're asking for more studies or larger numbers of kids in these studies, and they're trying to get a better sense of side effects. That to me, that raises a little bit of a red flag that they may be seeing something, but we'll just have to wait and see. It's hard to know what's going on, or it may simply be that with up until the past few weeks that there were just too few infections that they couldn't tell the difference between the two. So we're just going to have to wait and see. But unfortunately, we won't be able to vaccinate kids under 12 before school starts here.
Also, too soon, you're going to be having a sit down with the superintendents in the area. There's a lot of concern of folks saying, a student gets COVID-19, and should they return? What are the rules supposed to be, and the like? Can you talk about, some of the policies that are out there right now that you've seen, and what are you recommending to the school districts right now?
Yeah. So what we're recommending is that if kids come to school sick, send them home. And if that turns out to be a problem, we're fully prepared to issue a quarantine order for the child and the household, and then put schools in a bad way when parents send kids to school sick. And I understand that sometimes parents, they need to work and it creates problems for them. But really, if your kid's sick, whether it's from COVID or anything else, you shouldn't be sending them to school. Just keep them home and find a way to take care of them. So what we're going to be doing is we're going to be meeting with school nurses this week, and we're going to be setting up with school superintendents as well to kind of go over what the recommendations are. There are a lot of recommendations out there, and a lot of the recommendations, they come from TEA, they come from CDC, they come from dishes. They don't always go together. And so what this does is this gives an opportunity for us as the health department, and every one of these guidelines say consult with your local health department. That'll give us a chance to say what we would expect. And one, don't send kids to school sick. And then two, if there are contacts that are having severe contacts, probably ought to send them home. This is particularly important now as we see these numbers going up. With the numbers going down where they were 3-4 weeks ago, 5 weeks ago, you can understand that everybody's kind of taking it easy and not not too worried about it. But the way things are going, this thing is potential to spread like wildfire through the schools.
And again, I've asked this question several times now. What is it about the Delta variant that makes it more transmissible and makes it such a, because this is what is driving the whole thing right now.
Right. Yeah.
And how's that compared to the Lambda variant that's also kind of, it's not anywhere near the same number, but that it's also out there?
Yeah, I have a colleague of mine who's from Peru, which is where the Lambda variant comes from, and he keeps asking me about that as well. But the Delta variant seems to have the virus gets into the nose through the spike protein. This is a protein that sticks up. It's got a little hook on the end, and something about the Delta variant, that hook is hooks on really easily and gets inside the nasal cells. And then because of that, it hooks on better. Even a little bit of virus can infect you a lot more rapidly. And then once it gets inside, it seems to replicate more rapidly as well. And that's why we're seeing more spread, because it gets in more easily. And then if I get it, it's coming out of my nose. A lot more of it is coming out of my nose. So, I guess a good way to think about that, if you've been watching the Olympics and watching these swimmers underwater and they breathe out and all this, this air is coming out. When you're infected with Delta, that's what's happening, except it's virus. And it spreads everywhere, and then it goes wherever it wants to and hooks on someone else's nose and makes them get infected. So that's why we're seeing people get sick faster. Get infected faster. And that's also probably why we're seeing some people, even those people that have been vaccinated, having symptoms. Whereas, before Delta came along, we were seeing a lot of people not having symptoms. Even though they were infected. And that, it gets in there, it's higher volumes of virus, and more virus means more sickness. So that's what we know about Delta. Lambda is very similar. It's hard to know how well that will translate in an American environment, because, the healthcare system in Peru is not as robust. And so, and they don't have as many safeguards as we've had. And so it spreads much more rapidly. So seeing things in like these middle tier countries than come United States, will it spread as rapidly? Will it cause as much illness? Well, Delta has certainly spread as rapidly as it did in India, but it doesn't seem to be causing the same level of disease and people dying as it did in India.
One of the things too is, I understand the frustration. I mean, we were essentially told, all right, get vaccinated.
Yep.
And you can have a near normal life. And in fact, we were just seeing that turn happen. Cruise ships back, you take your masks off and everything else. So I'll ask the question that a lot of people are asking: what happened? What happened to my freedom? Would be the biggest question in there. And break that down for us.
Well, the virus didn't read the Constitution. Okay, so arguing civil rights here doesn't do us any good. What happened? It's the same thing that happened to me. I've been vaccinated. CDC said, hey, you don't have to wear a mask if you've been vaccinated. So I took my mask off, and then everybody took their mask off. And I knew full well, just like everyone else did, that there are people walking around who haven't been vaccinated. But, at some point you say, well, fine, that's on you, right? And then, then we got 4th of July, and, we had a big parade in Galveston, and I was in the parade. We were on a float, and we had a great time. And I think that's where it just spread very rapidly. The rapidity in which Delta spread really shocked me, and it shocked a bunch of us. And I think it was a variant that we hadn't seen before, and I think without this variant, we might be in a different place than we are right now.
And I wonder too if that gets into the question I think I've asked you every single week. It's that I get asked this from folks all the time: booster shots. When Pfizer first said, we think, because we're seeing some waning, that we think there should be booster shots. C said, just a few weeks ago, said, no. We're starting to hear that even change a little bit. Pfizer was able to go last week, talk to the CDC, talk to the FDA, show them their data. And one of the things that came from that shows is that even now, the efficiency rate of the Pfizer vaccine is, they say, 88% against the Delta variant. Yeah. That's much lower than their 94%, we should point out, against COVID-19. And because the percentages in that are a little bit different than we would say otherwise. But what about booster shots? Is it going to be one of those things that, come September or so, October, that maybe it'd be recommended that, hey, go in and get a shot of something at this point? I know the clinical trials are going on right now.
Yeah, it wouldn't surprise me if that's where we are, looking at the way things are going, and also seeing that the things are coming out as people look at these. There's a proposal right now in front of the CDC and the FDA that they change the recommendation for boosters for people who are over 65 or people that have underlying serious conditions that would mean that they'd have a bad outcome with COVID, that they get a third shot. And I have people coming up and asking me, and initially I was saying, no, don't do it. Now I'm saying, I don't know, but if you want to get one, go ahead. And that's, I think, where we are right now. There's no formal recommendation, but there are people that are worried and beginning to go to their doctors and saying, can I have a third shot? And they're getting them. So, I certainly, I wouldn't encourage it, but I wouldn't discourage it in people that are worried about it.
Yeah, I get that question asked every single day, and this from my personal conversations with you. I've been asking myself personally, just because I was like, "Hey, can I go get a third shot?" And is there nothing really preventing me from doing it? I just
right. Well, and when that first question first came up, I sat down and I said, I don't know, how can we give people third shots? How are we going to put it in the state system? And the people that entered in the database go, oh, it's in there already. We have people, they got J&J, and then they got one of Moderna, and then they got one of Pfizer.
Right.
And so there have been people that have been doing that. And again, we don't recommend it, but there's no real barrier to say no. And right now we have plenty of vaccine, and I don't think anybody's going to tell you no. But again, it's not recommended to do at this point. But but if you're really worried and if you have risk factors, talk to your doctor and say, do you think I'm somebody who might benefit from this? And think about
it. And the other thing that is along those lines is kind of the tweaking of the vaccine. There are some clinical trials there, make it more effective against variants. Explain the difference, like J&J and the mRNA vaccines from Pfizer and Moderna. Is it not that it's one of those things where coding, because the mRNA vaccines, the coding can be changed a little bit quicker to adjust to conditions on the ground, as we would say normally, correct?
Yeah, that's right. So the mRNA vaccines are basically, it's a single strand of RNA, and it's made up. Think of it as a string made up of beads. Okay. Mm-hmm. All you got to do is say, okay, I'm going to change that bead, and I'm going to change that bead, and I'm going to change that bead, and then the rest of the process is exactly the same. And they have a package, so they make the chain. They have this packaging process that puts those beads into a little molecular package, and then poof, it gets put into a bottle and frozen and sent on its way. So the technology required to make those changes is not that great. Now, with the AstraZeneca vaccine or the J&J vaccine, they're a little different. They're actually what's called an adenovirus. So basically, instead of putting it in this lipid package that the body just sucks up, it's actually put into a different virus, and that requires a lot more engineering, and so the process is more difficult to do, and they don't lend themselves as well to changing them.
And now the reactions to things that are going on, we're seeing some, as I said, we talked about the CDC probably going, it's already saying, if you're inside and you're vaccinated, probably in certain conditions, go ahead, mask up. We're also seeing come back into the fold, folks being I say new, it's kind of old visitation restrictions come back to UTMB. Let's listen to this. This is Dr. Go ahead and Sharma, who is the medical director over at UTMB. Let's take a listen to what he had to say on that.
We actually set up an alert system over the last year, depending the test positive rate in the community, the number of patients that are tested positive, our hospitalization rate, and our vaccination rates in the community. So we have an alert system that we created internally that when we need to make changes to visitation policy, as well as staffing and other things that we need to consider to keep our patients safe, as well as staff safe, so we can provide care in this fourth wave now. I think we are trying our best. So we actually have abundance of vaccines that is available. Unfortunately, we are not seeing a major movement in the public, despite repeated warnings that most patients that are admitted in the hospital and dying since June are unvaccinated individuals. And another concerning thing is majority of them are below age 50. We have seen a significant increase both in our test positive rate. The test positive rates have already gone 3 to 4-fold what we have seen about a month ago. The hospitalization rates have also gone 3 to 4-fold. right around end of May, we were running just a census of 25 patients. Currently, today, we have 98 patients in hospital. We have actually refused transfer for 25 patients over the weekend because we did not have capacity to manage these patients, given the staffing and the space issue.
And we should point out here is that, yes, COVID patients have come in the system. I don't want anyone to get confused here. It's summertime, so we're going to see an increase in the number of patients that come in UTMB anyway, for just general people getting out and about again. Everything from, you're working in your yard, overheated, and the like. So when we talk about capacity, it's not as if the entire hospital UTMB system is full of COVID patients, but it is 100 when we talk about system wide. Most of those are going to be Galveston and League City. That's just those are the two larger of the hospitals that would handle these cases coming in. But he had pointed out that some patients had to be sent somewhere else because they didn't have the capacity. Mainly that was staffing issues, is what he clarified a little bit later. That's the real thing we're talking about here, about that. And then that's why the visitation rules. Now, I know a lot of folks didn't like the visitation rules the way they were before. And basically, it comes down to this. If you're in the clinic, you can only have, you can't have, if you're a COVID patient, no visitors whatsoever. If you're a general surgical or clinical patient that's in, you're going to be able to have one person come in only during 5 to 8 in the evening. And there are specific rules. We'll put the link up for folks to go look at those. You expect we're going to start seeing more and more of this as well, maybe nursing homes again as well at this point?
No, definitely. I mean, one of the issues that we're facing is that as people come in and visit, they can bring COVID with them. And particularly when you have a very vulnerable population, like people that are sick in the hospital, you don't want someone coming into the hospital for something else and then getting COVID. Or you don't want somebody coming in for a routine procedure and accidentally giving COVID to someone else. So that's the reason why we need to limit visitors. That's the reason why we need to test people before they get procedures. And I think you can expect things like this for nursing homes again. I hope to God we don't get to the point where we just have to lock people up in nursing homes. I mean, that was just awful. The poor people not able to see their family members. But we are really going to have to start tightening up around those vulnerable populations.
And again, the questions on back to school of going on. Right now, when the authorization came out for 12 and older, there was an effort with a few school districts, Dickinson and Texas City, namely. Those are the ones we were with you on. I think some other districts as well. Is there some work underway to have some, vaccination clinics, for the lack of a better word, at some of the schools right before the return to help out there?
Yeah, no, we're talking about that and talking to them about, talking to the schools about having things there, and also having the potential of even having vaccines in schools administered by the school nurses. Now, a lot of things have changed since we started that effort. With Keiser, we could only, in the past, we had to keep it frozen and only use it right away and discard it as soon as it was unfrozen. But now we can keep it on the shelves inside a refrigerator, or a normal freezer, I should say, for up to a month. So what that means is that school nurses can have it on their shelves and use it as well. So we're looking at strategies to make it just as easily available as possible, and not necessarily have to go to the heroic means that we did to earlier this year to get people the vaccine.
Let's get to another subject now that has come up in recent days, and that is about cruise ships and particularly Royal Caribbean's Independence of the Seas. 4 crew members that on the Independence of the Seas. That's going to be the first ship out of Galveston on the 15th, or that's what the schedule is. It's doing some tests, setting up for some test cruises that start the 1st of October. 4 members tested positive for COVID-19. Can you give us an update on their conditions and how Royal Caribbean handled that? And then we'll also talk about their situation with one of the Carnival ships.
Yeah, so they informed us that they had 4 crew members that were positive, and they also had about 29 crew members that were in quarantine. And one of them was taken off the ship and sent to UTMB for evaluation, but I don't think they were admitted. I think they were okay. The Royal Caribbean strategy is different than the Carnival strategy. Carnival strategy is to have 95% of the people vaccinated, both crew and passengers. Royal Caribbean is not doing that, which means that they have to have a test cruise. And so, we're obviously very concerned as we see numbers of people with COVID rising dramatically, and particularly significant numbers of those we don't know, may not be vaccinated, that it may not work very well. I don't know. We're just going to have to wait and see what happens there. Carnival's been working out pretty well. They've had probably almost 4 weeks of cruising now. We've only had one episode of a passenger getting testing positive. It was someone who had been fully vaccinated but had been around someone who had COVID. They knew about it. They didn't tell them when they got on board the ship, because if they had, they'd have been told they couldn't get on board. And then they got sick, and they were quarantined on board ship, spent the whole cruise in their stateroom, and their whole family did, and they were all well and were put in their car and were able to drive back home. So I don't think it was a very happy cruise for them, but the procedures that we worked out with Carnival worked out very well.
And as I said, they weren't infected; they just had come in contact. And how did that emerge? That they did find that out at some point, because that was the interesting.
They had diarrhea, and so on board ship they went to see the doctor, and they have protocols. If somebody gets anything that looks like it may be COVID, they get tested, and they were positive. So that's how they found it out.
Yeah, and we should point out too, and this is something we discovered on our cruise there, because of different, not us personally, some other folks who they were having to pay for tests, and they're getting those rooms. Their rooms were getting billed every day for testing because they decided they weren't going to be vaccinated and came on board. They didn't have their CDC cards and didn't have and they were paying the extra for it. They were upset.
I think it's like $150 a day, right? So
So
don't lose your CDC card.
Yeah, they lost their CDC card when they were in Cozumel and coming back on. It was happening right in front of me, and I was talking to them and what had happened, and the crew was explaining to me what their policy was. I knew part of it. I didn't know the full details of it. As you take a look, this is the Independence of the Seas from this is courtesy video from Royal Caribbean. Again, the test cruises for Royal Caribbean are scheduled to begin this week. The Independence of the Seas is scheduled to set sail on the 15th. It does get into a question though too, is we're starting to see Delta variant take hold. Was the summer surge somewhat expected, and because we were going to see people taking their masks off, going out and enjoying themselves more close contact, more seeing grandma and grandpa, going across. Was this to be somewhat expected, but not this high of a level, even with vaccination rates the way they were? Just give kind of a perspective on that.
Yeah, I mean, we were all worried that we would see some sort of summer surge, but we were worried that as soon as the restrictions on social distancing were lifting and masking, we'd see a big surge, and that didn't happen. And so it continued to dribble down. So I was feeling pretty good about it, and then we saw Delta hit in a big way. And what was really interesting, we knew Delta was in the community. We knew Delta was in the community, and we knew the numbers of Delta were rising, but we still were seeing numbers go down. And it wasn't until we got to almost 100% Delta that it exploded. So small numbers, it took over 100% Delta, and then boom, last week of June, you see a big jump, and then it starts going straight up from there. And in some ways, I guess we should have expected it, but the rapidity at which it's happened really took us by surprise.
Right, and it spread so fast. In here. Again, I want to give a chance to debunk what we have been saying here. I know some folks see this and they say, we've actually had someone say, quit showing the comments from folks. One of the reasons we allow this to go is we're not going to censor folks here. Where this lady, Mila Garcia, is saying, so vaccines don't work when you're around people with COVID. That's actually not accurate. Let's
right.
talk about this. It's between vaccination and not. It's got to be taken with the data as it is factual. So I just want to give you a chance to talk about that.
Right. So what does work mean? Okay. And I think a lot of this has to do with expectations, right? And nobody ever said that this was a binary thing, that you get vaccinated and nobody gets infected, and you don't get vaccinated and everybody gets infected. It's never been that way. Anytime you have an infection like this, there's what are called attack rates. An attack rate is of the people that are exposed, how many people get infected with every single exposure. So it's never 100%. What was really surprising about the COVID vaccines was how well they did work. And by that, I mean, compared to other vaccines like a flu vaccine prevents flu about 50% of the time. We do that. We're pretty good. Quite frankly, if you told us that we're going to have a COVID vaccine that's going to work 50% of the time, we'd all said yay. We were very, very fortunate that these vaccines worked in prevention of COVID about 95% of the time, and prevention of severe disease and death about 99% of the time. What that means is that there will be people that will get COVID. There will be people that will get sick. There will be people that die. There's no way we can change that. There's a very famous scene from MASH that rule 1 in wars is that people die, and rule 2 is doctors can't change rule 1. So we can't change rule 1. We can't change that people are going to die in pandemics. But what we can do is we can change the number of people who die. And that's what we've been seeing. We've been seeing the number of people drop, who get sick, who get infected, drop dramatically. The number of people who get sick drop dramatically, and the number of people who die drop dramatically in those who are vaccinated. But we're in a funny situation right now in that we've only got about half the people in the county vaccinated. Okay, we've got almost 60% of the eligible people, i.e. 12 and up, but we've got all these kids under 12, and so when you add them all together, we're only about halfway there. That means we're only about halfway done in terms of what we need to do in preventing this infection.
Actually, a rare thing happening, a straight up question here. Jim Martin asking, if you're asymptomatic and have emphysema, should you get tested before taking the I think he meant to write taking the vaccine there instead of talking the vaccine, taking the vaccine. And it goes to a bigger question here, and that of before you get the vaccine, you should probably be talking to your doctor if particularly you have special conditions out there, correct?
Yeah, and we would recommend that for any type of thing. If you're not sure, check with your doctor. But if you have emphysema, you don't need to get tested. There's no reason to test anybody before they get the vaccine. If you're not having symptoms of fever and cough, just come on in, we'll give it to you.
And obviously too, as we get around here, should we be talking about, again, I say we, but where's the consortium? We saw this up until May of this year. The health district working with the county, working with UTMB, they had the mass vaccination site at Walter Hall Park, some outreach in the communities here. So should we be talking about mass vaccination efforts returning?
Yeah, well, what we've been doing for the last, I don't know if it's May, June, July, the last 3 months is trying to make sure that there's vaccine in every venue that people can think of. So, it's in pharmacy now, it's in doctor's offices, it's in clinics, it's in emergency care centers. There are very few places where you can go where you can't get a vaccine, and that's what we wanted to end up at. We don't need to do the mass vaccination at this point, simply because the whole idea behind mass vaccination was twofold. One was that we did have enough vaccine to go around. And then 2, we wanted to get it in as many of the eligible group, which initially was over 75, and then we moved to 65 and 55 and on down as quickly as possible. Right now, we've got more vaccine than we're using. We haven't ordered any new vaccine in probably 6 weeks, and we still have thousands of doses on the shelf. So, there's no need to do a mass vaccine site. Now, people, after this broadcast get worried and decide they want to get vaccinated and show up at the health department and UTMB all wanting vaccine at the same time, maybe we'll reconsider it. But right now, we have more than enough resources to give the people that want the vaccine any day that they want it. call up, come on in. If you even just walk into the health department, we'll give you a vaccine.
Yeah, and from what I understand, there's actually vaccine available, all three at the health district. Now, it used to be just Moderna, but I think if you want any of them, you can get it now. Correct?
Right. We have Pfizer, we have Moderna, and we have J&J. J&J is probably going to run out, and UTMB has some left, but we're going to run out of J&J. It's interesting is that people are not nearly as excited about J&J. We even had some people, when we say, hey, we can give you J&J, you only need one shot, they go, oh, I don't want that one.
Well, yeah, I mean, early on there was all this talk of, oh, I want J&J, I want J&J. That waned pretty fast, did it not?
Yeah, because it's probably not the same level of effectiveness. That doesn't mean it doesn't work. It works almost as well, but not at the same level. And then there were issues of side effects, which paused its use, which made a lot of people nervous about it. And so when you put those two together, plus the fact that Delta seems to be more infectious, I think more people are opting toward what they feel to be the more efficacious vaccines. And I understand that.
Here's an interesting question that Milad asked here. Any medicine that's being established that would not have to be injected? I know that there's a pill being worked on, correct?
Yep. Yeah, it's an antiviral pill, much like Tamiflu. And I don't think it'll be available in 2021, but probably early 2022. And basically, with this pill, it's an antiviral pill. You go to your doctor, you feel bad, they'll test you for COVID, they'll test you for flu. They'll say, oh, you've got COVID, here, take this medicine. Oh, you've got flu, here, take this medicine. And so if we can get to that point, it will make things a lot simpler. Because right now, with the medicines we have, they have to be given intravenously, and they're hard to give, and we have to put you in the hospital. And so it'd be just so much better if we could say, here, take this. If you don't feel better in a couple of days, come on back.
And this question too from Brenda Arredondo. If I have COVID now, how long do I have to wait to get vaccinated? Is there a wait period?
Yeah, we want people free from symptoms. That's basically it. So, once your fever goes away and you're 10 days out, we can go ahead and vaccinate you if you'd like to get it.
Another one I'm hearing a lot of, and this has come up several times, preventative measures to take, meds and the like, and not really put the brain. Is there really anything that's a preventative outside of the vaccine?
No, they don't work. It's so funny. How we've evolved with this. Everyone has made a big deal over giving hydroxychloroquine in the nursing homes, and we did that early on. In April of last year, and Dr. Robert Armstrong, who was or is the medical director of one of the nursing homes, called me up and said, what do you think? And I'm going, gee, I don't know. Got all these old people, they got COVID, some of them are gonna die, if you can get it. And he says, I think I can. And sure enough, he made some calls to the governor and was able to get it, and gave it to some people, and a few of them died, but most of them did pretty well. And so that gave a lot of us some hope that maybe this was something we could use. But over time, there have been numerous studies done, and they just don't work. They don't work in treating it, and they really don't work in preventing it. Ivermectin, if you have worms, great drug. Hydrochloroquine, if you have malaria, depending on what kind you have, good drug. If you've got lupus, great drug. But does not seem, now that we've had the tincture of time and experience in thousands upon thousands of patients, they really don't seem to do any good.
And we should point out that those weren't ever considered as preventatives. Those were, once you got it, those just.
But some people were, and were advocating as a preventative medicine. And at one point, President Trump was advocating hydroxychloroquine as preventative. And then there are others who have been advocating ivermectin. And again, it was one of those things where there was a kind of a, I don't know, circuitous mechanism that it might work, that people said, that's interesting, and then tried it in a few people, and they said, see, I didn't get it. And but when tested in large numbers of people, it's really not proved to be very helpful.
And again, it comes down to the individual health too. I mean, that's the one thing, I guess, the one thing COVID has proven. Your individual makeup has as much of an effect on this of how sick you can be versus it's not a cookie cutter deal along the way. And we've heard about this a lot. I thought this is our first time a chance to revisit this. Vitamin A and D in high doses to inhibit the spikes from attaching. We've talked about vitamin A, the benefits of vitamin A and vitamin D. We say take your vitamins, but high doses, any vitamin can be dangerous. But how about, I haven't seen any studies about this specific question here.
Now, I've heard the vitamin D and not the vitamin A one. But again, I don't think we have evidence that it really does. But I would, tell people not to take vitamins, but particularly a lot of us, particularly those of us with light skin who work under fluorescent lights and don't get outside. We have vitamin D deficiencies, and correcting that has been shown to help with a variety of different things. But is it specifically going to prevent COVID? I don't see any evidence that it does. Is it going to make you more healthful? Sure. And does that mean you'll do better? Yeah, we think so.
Yeah, it's not a bad thing. Not
a bad thing. No, I'm not telling people don't do it, but don't use that as your main line of defense.
Right. And we were talking about back to school issues earlier, but reminder that the Galveston County Health District having its back to school bash and open house on August the 14th. Health District, along with Coastal Health and Wellness, it's going to happen at outside the clinic, or at the clinic, I should say. From 8 to 1 on August 14th. That's in a few weeks. It's right before school comes back. That's at 9850 Emmett Lowry Expressway in Texas City. That'll be taking place. Backpacks, school supplies will be handed out there too. Sports physicals. Now, immunizations and food. Now, I want to clarify something here because you and I are both going to get a call from Ashley here if we don't stress it. Immunizations are being offered.
Yep.
No one's just going to show up, and they're not going to just go randomly around and poke you with the syringe. Okay. This is if you want to have any of your immunizations out there, including COVID immunizations, not just for the kids, but for adults as well. So if you need to get your back to school, your TB, all of that, you can go ahead and get that as well. We'll be out there as well. Haircuts for kids too. That's something that's back to school. About there. So, and anyway, so just so that's happening again, and it's free COVID-19 vaccines that day too, but other vaccine immunizations offered as well there while the supplies lasted. Again, that's August 14th from 8 to 1. And then we'll start and we'll see, hopefully we'll see some folks out there that day. School supplies and stuff are going to be the tight thing for a lot of folks to get. As well as we're seeing kind of the logistics of that coming along. So, Dr. Keiser, thanks again. As always, we appreciate you coming. I'm going to hang around at the end of the show. A couple of things we got to take care of business-wise here too afterwards. And then we'll let you go there. Again, folks, if you have any questions, we'll be back on. We're going to be moving our show now to Tuesdays at 2:30. At least that's what our shot is, our what we're shooting for each week. A heads up, though, the week of the 16th, you're going to be out the week. So we won't have a show that week, but we're going to try to keep it up going weekly. Dr. Keiser is a lot more busier. You think COVID had him busy last year. It's even more so now with his multiple hats that he's in charge of here. And next week, hopefully we'll be able to get more updates from the schools as well about what their procedures are going to be and what their recommendations to them. Again, thanks for joining us. Hang along. I'd like to chat with you right afterwards. And we're going to close out the show here, but not first, this word from Coastal Health and Wellness.
Hi, I'm Christina Garcia. I'm the Patient Services Manager at Coastal Health and Wellness. I want all Galveston County residents to know that the open enrollment for the healthcare insurance marketplace is now. At Coastal Health and Wellness, we understand the importance of having access to high-quality health care. And we understand that the application process can sometimes be stressful, trying to figure out which plan is best for you and your family. So we have certified application counselors that are waiting to walk you through the process. There are 4 categories of plans to choose from, and our counselors will help you through the process. All the plans will cover essential health benefits, pre-existing conditions, as well as preventive care. So what do you need to know, Galveston County residents? The time to act is now. If you need assistance or if you have questions, call us at Coastal Health and Wellness. We're here to help you.